Welcome to our podcast, PA Mindset Matters. I'm Jessica Spissinger, and we're excited to introduce you to our mini mindset editions.
I am Mercedes Dodge, and we created these short episodes for PAs, PA students, and all healthcare providers who want a moment to pause, reset, and reconnect with purpose.
Each episode, we will explore a reflection, practical insight, or mindset shift you can apply right away in training, in practice, and in life.
Because how we think shapes how we show up for our patients, our colleagues, and ourselves. So let's get started.
All right, so I thought we could just put something together on motivational interviewing because it's near and dear to both of us. We certainly covered a lot. So here we go. We're just going to do a quick overview. As usual, I have to start with a little bit of history. And I'm going to keep it pretty quick. The founder is Dr. William Miller. And before I get into kind of how it came to fruition, just to say, people say, what is motivational interviewing? I always like his definition best, which is a way of being with people to help people make changes. And I think that really is the bottom line, is really that patient-centered perspective. Developed around the 1980s, Dr. William Miller is a clinical psychologist, and him, along with another psychologist, Dr. Stephen Rollnick, put it together after Dr. Miller went to Norway to do this treatment center alcohol addiction conference that was going on. He was a lecturer. And all he thought he was doing was just being a patient-centered provider. And all of the audience was like, you put together something really brilliant. And they brought that to his attention. Dr. Rollnick really went through their process and made it more systematic so that they were able to share it. So originally its roots were out of alcohol addiction. And for many years, people saw it that way. But over time, its impact really broadened. And it was noted that there was a lot of options to expand its use beyond substance use into mental health, into preventive care. There's over 2,000 studies. So if we're looking for something that's evidence-based, motivational interviewing is beyond that. Slide. So where is it utilized? Like so many places. And I think that this is something I always lean into with our PAs, just to say that we always cover this in PA education before PAs graduate. So when we think about like our counseling modalities as PAs, this is really a foundational process for us. We use it so much, whether, for us, we work in psychiatry, but in primary care with disease prevention and so many applications it's utilized. So I always like to say, we're going to dive into a bit more about some of the specifics, but what it is not, it's not expert opinion. It's not problem solver. It's not fixer, solver, rescuer.
It is not directive, like instruction manual. And I think that's what I love about motivational interviewing is I see that it is used in parenting because we want our kids to start thinking on their own, and we can't expect them just to follow our manual. So every person has their own compass on what it is important for them. It's not a manual. It's more of a way to approach communication, connection, and helping the individual build on themselves.
Absolutely. And I think that as we go into some of the granular bits that it has, there's some techniques. It's good to know these, but I always like to just start with bring it back to what is the ultimate spirit of MI. And just like you said, it's not a manual. It's really like a philosophy of your approach with your patient, which is going to be collaborative. It's going to be accepting where each of you are at in your joint collaborative process. You're going to work on trying to come about change with evocation, which is like the gentle bringing forth of the person's intrinsic motivations. And of course, always having that spirit of compassion. All right, so we're going to run through these essential concepts and techniques, but with the caveat that while we can learn these techniques, we've got to put them into motion to make it real. So for today, we're just going over these concepts. This is the map that we have created in the past, and I think it lays things out pretty nicely because there are these 4 different concepts: the engaging, focusing, evoking, and planning, under which there's different techniques that can help to guide you through. So we're going to go through that, but you may have heard of ORS, you may have heard of darn cats. I think a little bit less often, you may have heard of ask, offer, ask, but go back here when you kind of want to lock in those details. Okay, the engaging, focusing, evoking, planning, we're talking about accurate empathy. I think that's where every visit with our patients start. Like you've got to come in and recognize wherever they're coming from, that you're approaching it with a non-judgmental attitude. The mirroring really gets into our process of conversation. I'll go into that a bit more. Accurate empathy, we're talking about just verbalizing what we think our patient may feel like to make sure that we're on the same page, because maybe we're making assumptions that are not actually accurate. Listening alone, not conveying empathy.
So,
Yes.
in regards to accurate empathy, I think this is something that we all have some level of empathy in ourselves, but we actually have to keep on practicing checking in with ourselves because we all have implicit biases that are unrecognized. That lens of, I do have empathy, but there's areas that maybe I hold implicit bias to patients. We're not going to always get the accurate empathy on point. So there's always an evolution there as a provider. So that's just something I wanted to mention about accurate empathy is continue to check in with your implicit bias.
Yeah, I agree. And I think that it's one thing to listen, but listening alone does not convey empathy. When we're talking about mirroring, we're getting into these techniques called ORs. So this is where we're suspending judgment, trying to understand what it's like to be in the person's shoes. And the ORS techniques are kind of the more popular associations with MI. You may have heard of it. So it's our open ended questions, it's our affirming, reflecting, and summarizing. And are we going to dive into that? Of course we are. All right. So we'll take it kind of one by one, starting out with our open ended questions. What's interesting is that sometimes, depending on how the conversation is, depending on the setting, yes or no questions still have a place.
Yeah.
Sometimes we want to unburden the patient by, kind of putting out the thoughts. Like sometimes people feel like very hopeless, like they don't want to live anymore. Does that ever happen to you? And then by them just having to say yes or no, they're able to convey a lot without having to have to put it all together. Just to say that the whole point of opening with an open-ended question is really to try to encourage the person to talk, avoiding any kind of restriction like we do with our review of systems sometimes, and using a variety of approaches. I
And
think
I
that
just wanted to add like that, where's the place for yes and no? Because I think that a lot of people might interpret this as this black and white. No, you have to have an opportunity where those open-ended questions makes asking
Mhm,
who, what, where, helping patients dig into their thought process that maybe you kind of already know, but you want to make sure that they are voicing it out loud so you can get to a mutual treatment plan. The yes and no's, I love that comment because we have to
mhm,
validate a lot of things. A lot of people do have suicidal thoughts. And so
mhm.
some kind of normalizing it and having them just
Yes.
kind of like realize, oh, I can say yes and it's okay to talk
Mhm.
about it. And I know there's studies, so many studies about not interrupting patients. Most providers interrupt within 10 seconds. So
Hmm,
try to,
interesting.
I think one of the things as PAs or providers, when we start trying to connect and do that therapeutic alliance, try to see if you can do 3 deep breaths, allowing the patient to just talk. And so it'll get you past that 10-second rule.
The other one I like is affirmations because I think affirmations often get lost. We get busy, and if we are really good at our open ended questions, maybe we're forgetting to bring back to the patient some acknowledgement that we recognize their process. We recognize that either they're making efforts in their life or that, they've done more maybe than they see from session to session. And I think it can really go far, to let people know that we're hearing them and that we see that even within their framework, which might feel more negativistic, there's actually like a lot of positive things that they're doing that they don't realize.
I use that a lot with teenagers just because there is a lot of individuals with negative talk in their thought processes, is that I try to mirror positive affirmations and give them examples of what I would do to myself when I'm feeling down.
Sometimes you really see patients kind of like light up and they're a little surprised. They're like, oh, I hadn't really thought of it that way.
Mhm.
Nice. Mirroring is, our basic reflection statements. So again, a way of conveying that we're listening by reiterating what was said, making sure that we're on the same page. Like from what you said, I think what I heard was, XYZ. And you want to do it in a way that's conveying the true understanding of what they're saying, parroting back what they say.
Yeah, I think that a lot of patients come in possibly with the ideas that I or we know all the right answers. We do
Mhm.
have great medical knowledge, but to be able to say, you know what, this is what I think I hear you saying, and I want to make sure that I'm getting it right so that I can kind of provide you some guidance and recommendations. Just let me know if I got it wrong. So having that humility and that be able to say, I am a human and I'm trying to connect your human experience with my medical experience. Mirroring is so important in that therapeutic alliance.
Yeah, absolutely. And that's why we've just gone through the four oars, those four components. And I just love them so much because they're such a great way along the same that bucket of mirroring, we're summarizing. And so this can kind of take a little bit of technique, a little bit of practice, but this is when we're really trying to put it all together. Again, reiterating that we're all on the same page. We've heard what the patient has to say, and we're going to continue to move forward together. So that's really the last of those fours, like those four different components. And I think they're so helpful to revisit in your practice, just as kind of like a reminder, like when you reflect on a session or you've got one coming up that maybe you're a little apprehensive about, is if you cover these 4 points, that goes a long way. All right. Another component of MI is the decisional balance activities. And this is a very useful exercise to do when somebody's on that brink of acknowledging that they want to make a change, a little bit uncertain. And again, your position as their clinician is not to make a stance for or against the change, but here we very clearly with the patient kind of weigh out those pros and cons, the advantages and disadvantages of change. So I just threw this in here as a reminder. Okay, so we talked about the focusing on to evoking. This is where we start to move a little forward into the idea of making a commitment for a change, having the activation plan, and starting to take the steps forward. Okay, so this is what we call our proverbial cats. Anything to say before I go forward?
Yeah, just recognizing that as medical providers, we have a reflex to solve things or prescribe things. We need to take a pause and think about where is the patient. So the more you force, the more resistance, just like, physics.
Yeah. And, as we are here at the turn of the new year, a lot of people are about making new commitments, making plans that they want to do, all of those resolutions. And so when you're in that mobilization phase, the statements from the client may indicate their commitment to make a change. They may say, like, I need to make a promise to myself. The next step that I'm going to do is going to be X, Y, and Z. And when you hear that, it's really important to reinforce that they are making a positive commitment.
Catching those nuggets. And I think the more that you practice this, it'll be a little bit easier to find them.
Absolutely. So activations are the statements where you're starting to be on the brink of change and you want to continue to elucidate more information. If they say, I would consider, doing something or they're willing to, they're thinking it through. And again, this is not when you're trying to go in for a hard sell. You're just trying to elicit more information from them. Taking steps is recognizing you and the patient together. The question is going to be, what are the next steps going to be to move forward? So they've identified something. Now we're going to kind of break it down into smaller details and sustain talk. All right. So sustain talk is essentially opposite darn cat. So this is where we're like, using our listening ears to hear that they're making statements like, that they've thought about the change, but this is where they're kind of backing off, like maybe this is not the right time to make the change. And that's something that's important to acknowledge as well. So someone might say something like, I've tried to quit smoking before, but it's just so hard because all my friends smoke. Or I just enjoy using my phone, like all the little game apps so much. I just don't think I could give that up right now. And that's important to recognize because that's a way to convey to the patient that this is where you're at. And it sounds like there's a part of you that wants to go forward and make a change, but it sounds like there's some advantages that you feel like you just want to remain as things are. All
Finding that
right.
balance and recognizing and reflecting back to what the patient is saying.
Exactly. So again, emphasizing autonomy, reframing, etc. So pendulum approach is kind of being with a patient, recognizing that making changes in their life is not a linear plan. Oftentimes, this is a very circuitous process. We explore the depth and breadth of the issue and swing back and forth, just like a pendulum, which makes sense, right? Just like everything in life. However, sometimes we get to the point where a plan does need to take shape. And the way we go about this is we make our brief action plan, we do a confidence assessment, and then there's another technique I mentioned at the beginning called ask, offer. Kind of think about those SMART goals. Make, establish the goal. You want to identify the importance, explore the options, looking ahead to anticipate barriers, and reiterating the commitment to action and following up. The confidence assessment is essentially this tool that we use to evaluate a person's belief in their ability to make change. And so this is helpful to go back to. We can use scaling questions to identify those barriers and strengths, continue to use the goal setting and forming actions. And then we kind of really like draw it out so that when we have our follow-up visits, we're able to monitor the process and
Mhm.
progress and recognize again, so important to say that it's not always linear.
A good quick one is that, we tend to ask patients this past 2 weeks, how's your anxiety 1 out of 10? 10 being the worst. So sometimes that's a quick answer. This is going to be similar to that. Where you're like 1 out of 10. How confident are you to make a change? 10 being like, I'm 100% confident I'm doing it today or tomorrow. 1 being no confident. So using a scale like that's helpful.
Definitely. And then the ask, offer, ask approach is essentially the intention to promote the collaboration. And by its nature, it's very client centered, really trying to ask and offer information. We're facilitating the engagement, facilitating that we continue to have the conversation and supporting the patient so that, we don't want them to come in and feel like they've let us down or they've disappointed us. Like we're just here to continue to follow the journey as it is, reducing that resistance.
That sounds great. It's a
All
great
right.
summary.
So that was a quick pass through a journey of MI motivational interviewing concepts. So just your takeaway slide. Remember the engaging, focusing, evoking, planning, the oars, darn cats, it's all in there. But remember the spirit, it's all about being with your patient, being patient centered, and remembering that this can be applied in a lot of different conversations. So,
Yeah. We're gonna, give some other practical tips throughout this week, but I definitely want to mention that it is a process to learn these skills, especially if it's not second nature, as well as it is a dance and with the patient. So learning different types of dances because the patient comes from different lived experiences is the way that I would approach it.
That wraps it up for today. Thanks for joining us. Check out our next one.